So it's been a bit of a crashed day today. So welcome to my bed. I've just been going through my inbox because I run two social enterprises, which, if you don't know, they are not-for-profit businesses. So there's an awful lot of non-ME stuff that I get in my inbox. And I have to keep on track of all of it. I've just had something in from the NHS, and it was entitled Systems-Based Thinking. And I thought, oh, well, I'll give anything a read if it's going to help my advocacy. So, by the way, apologies for the graininess. It's because of the light coming in, and it makes my webcam go nuts, but you can still see me. So, anyway, so I read this thing. And I'm going to read it off my screen, but you probably won't be able to see it, because I don't think you will be able to, because I haven't shared my screen. Soon find out. Yeah, so it's called systems-based thinking. So seeing the bigger picture, understanding the entire system, how its components interact with each other, recognizing patterns, identifying recurring themes or patterns, considering multiple perspectives, taking into account the viewpoints of various different stakeholders, emphasizing feedback loops. That's important. And the outcomes can be influenced by previous actions, and addressing root causes. Now, all of that links into Shake It Up. Anyone that's new to this, Shake It Up is the campaign I've been running since it was the very end of October / beginning of November 2021, when the NICE guideline came out. And anyone that was following ME advocacy then, not just me, lots of other people, it was being said that there was no evidence of harm from graded exercise therapy or cognitive behavioural therapy. So obviously, thousands of people in the ME community said, hang on a minute, I've complained to my local CCG, my local NHS trust, my GP practice, lots of different places, to say, actually, I deteriorated as a direct result of the CBT and graded exercise therapy being offered either by my GP or my CFS clinic. So the community started saying, hang on a minute, that doesn't make sense. I know I complained. I know my friend in the ME community complained, blah, blah, blah. And then, we all talk to each other on social media. So thousands of people have, over the last, decade, 15 years, complained. And yet there was no recorded incidents of harm. So that's why I started Shake It Up. So since then, I've been asking for a reporting system to report harms from non-pharmaceutical treatments. Yes, I've done all the obvious things. I've contacted MHRA. They've said it's not a drug or a device. So no, we can't regulate it. I wasn't asking for it to be regulated. I was asking for somewhere to have it recorded. Just a high-tech version of an Excel spreadsheet would do, just so that we've got somewhere that's got gov.uk at the end of it that says these people say they've been harmed. It's their job to follow up and make sure that, yes, it was recorded in a GP practice, or, you know what I mean? So it's their job to prove that that actually happened. All we've got to do is report it. I've contacted over the years, because bear in mind, we're now in 2024, every single NHS department I can possibly think of, every single government department I can possibly think of, ones that don't really have anything to do with non-pharmaceutical treatments, but they might have something to do with data. I've thought outside of the box, as this systems thinking thing suggested. I've thought, I wonder if, they've worked on this that's got a vague link to what Shake It Up needs. I wonder if they can help. I've done the thinking wider, because a lot of people aren't like me. They don't think warm and fluffy. I don't want people to get harmed anymore. They just think data, money, data, money. So I've had to go down the data, money route. Still not got anywhere though. But anyway, so this thing that arrived in my inbox was talking about systems and how people need to work together. It just seems, addressing the root cause. Well, a non-shake it up thing, but kind of a shake it up thing, would be the COVID rates at the moment. Addressing the root cause would surely be something to reduce viral load of the country at the moment, because many of those people are going on to develop chronic illness. Many of those people are going on to develop ME. And then some of those people are being told to increase their activity level or do CBT to get better. There's anecdotal evidence, plenty of anecdotal evidence, to say that actually that hasn't helped, or it has caused a deterioration of symptoms. So they're not addressing the root cause, are they? That's my big bugbear, one of them at the moment. There's lots of NHS and government want to work with VCSEs, who are charities and social enterprises and community groups. That's what VCSE means. I can't remember what the individual letters mean, but that's what it means. And yet, anytime I've asked for a meeting or asked for progress on something or written to them and said, this is an issue, I've been told, oh, you need to go through a national charity. Hang on. I'm doing this because the charities haven't got time, or, they've decided it's not one of their priorities, because, they are only a set amount of people. They can't do everything. So I've kind of taken it on myself to get in touch with all these departments as a VCSE. And I've been told, because you're not going through a national charity, we're not interested. Okay. So I'm trying. And in all of their public-facing literature, announcements, policies, they're saying they want to work with organisations of all levels, of all sizes, all VCSEs, to try and improve things and bring about social change. Yet when people like me, who also want to do that, gets in touch, no, you're not big enough. You're not a national charity. So trying. Anyway, it tickled me, because this thing, it's like all, this is what we want to do. We want to give people feedback loops and talk about how the system can have effects, like real life effects. Well, yeah, your system is that you offer something and say, oh, there's no data at all on this causing harm, so it must be fine. We're going to carry on recommending it. And yet you won't allow the collection of data. It's irritating. It's all talk and not much action, in my opinion. Anyway, so shake it up. I am still continuing with that. I'm not going to give up on it, because we still desperately need it. I know there's some people in the community that are thinking, oh, NICE doesn't recommend it anymore. It's fine. No, it's not fine. It's still being recommended today. And they're still there, as in NHS, in many areas. And they're still trying to rebrand pacing. We know what pacing is. It's staying within your energy envelope and doing little and often and making the most of the energy you already have. It's being rebranded to increase your activity levels over they say over a longer term, but you're literally increasing your activity levels. What does that sound like? That sounds like rebranded a form of graded exercise therapy. It's like, do a little bit more every week. That's how you pace yourself. No, that's not pacing. So we need somewhere where, if a GP tells you to increase your activity levels under whatever name they use, you have somewhere where you can say, my GP or my CFS clinic told me to do this, and as a direct result, this happened. Yes, it's subjective, but they are, without any kind of reporting system, it will continue being said that this does not cause harm. If we'd had a reporting system when the NICE guideline was introduced in 2021, there would have been thousands of entries on that reporting system to say graded exercise therapy and CBT harms patients. But at the moment, there's no data. We don't know anything about this. No one's ever said anything. Yes, they have. Yes, we have. Anyway, Shake It Up continues. This Emmy Awareness Hour, if you've seen this video, please share my stuff that I'm going to be posting on Shake It Up. There isn't any point in doing anything politically at the moment because it's an election year. And at the moment, the Tories do not want to admit that COVID's still here and that ME has gone through the roof. They don't want to admit it. So they're certainly not going to give us a reporting harm system. So I'm not even going to waste my energy with that. But I do want to get as many signatures on the Shake It Up petition as possible. Please go to emmyfoggydog.org, the petition, and there's a whole page because it's a campaign, not just a petition, but there is a petition link. emmyfoggydog.org. It's been there for a long time now, so I think a lot of people have forgotten where it is, but it's on the website, emmyfoggydog.org, for the third time. But yeah, systems-based thinking is obviously something that I do without thinking about it, because everything on that list that I read out at the start of this video is what I've been doing for years. I don't just think ME and the specific needs for ME. I have to think wider, because I know that not everyone's got a warm and fluffy motive for doing things. I do not like harm to human beings. Call me weird. So that's my motive. But I know sometimes to get government, business, NHS to do stuff, you have to show actually this could save you money, or data would mean that you make better informed choices. But yeah, I just thought I'd pop in. Systems-based, seeing the bigger picture. Always have to see the bigger picture. I'm actually thinking about the person with ME that's currently in hospital. In the UK, yes, I know the hospital that she's in, but no, I'm not saying who it is, because I don't want people to bombard the hospital if she doesn't want that. She's the one that's an inpatient right now. We need to put her first. So there's lots of things I want to do in terms of that, but I won't without permission. But I am wondering if there's some systems-based wider. I'm thinking of ways to just bring back change for severely affected people, because it needs a system, as in framework. It's not just systems as in computers, but framework of the NHS, framework of healthcare, to take severely sick people into account. Even simple things like this in terms of system. So I emailed this person's MP at least a week ago now with the politician's guide on how to advocate for severely sick ME patients. And I said in my email, I actually ended up sending them 3 emails in one afternoon. So the first email said, this person, first name, second name, is one of your constituents. This is her address. She's too sick to contact you direct. And at the moment, doesn't have anyone else to represent her for various reasons. I just said, I do not want any information from you, but can you contact this person? This is their Twitter handle. She does follow you, can you contact her? Make sure, you can doubt me, but contact them direct and just say, is this correct? Would you like my help? Don't have to tell me anything. I know all about being a data controller. I'm a data controller with Foggy and with Stripey. So data protection is like a thing that I'm hot on. So I just said, I don't want any information from you, but please can you step in for this person because they're very poorly. And they came back and said, oh, thank you for getting in touch. We can't share any information with you. And I said, with all due respect, I'm not asking for information. All I want you to say is we will follow up. In which you don't have to tell me exactly what you're going to do, but thank you for sharing. Yes, we're going to follow up. Nothing. They've done, and I've checked with the person that's in hospital and they've said, I haven't been told that the MP's been in touch. Nothing's changed. So I had a look at MP protocol in terms of ministerial code of conduct, all this kind of stuff. And it says MPs do not have to act on everything that a constituent flags with them. So that could be why. But as the MP works with the Department of Health and Social Care, I'd be pretty surprised if they just thought, nah, I don't want to deal with that. I've just been told that this person's at risk of starvation, and no, I don't want to deal with that. I'm hoping that's not the reason. But in all of these rules and regulations, that I could not find a single thing that said, if my constituent is severely injured, has no family, or is severely disabled and are unable to communicate with me, or when I say communicate, I mean if they're not in the same room, they can't send a long email or they can't pick up the phone. That's what I mean by that. If like what am I allowed to do? There's nothing. It's as if they have not considered disability as a reason why the constituent wouldn't get in touch with them. Now that's a system process that needs looking at, because not everybody who is severely disabled has a family that would want to get in touch with an MP, especially with them, not in this instance. But if there was a severely disabled person and the family had, we know this happens, and the family had said, there's nothing wrong with you, they would not want to contact an MP and say, oh, my loved one says that they're at risk of starvation. They wouldn't do it. So there has to be a way for someone to step in without having power of attorney to flag with an MP, there is a serious issue going on here, you need to deal with it, and then them say, well, no, you haven't got power of attorney, you're not a relative. There are thousands of people in the UK where they don't have a representative to speak for them. So that's an issue. That's a systems-based thing that I'm going to flag. I'm going to contact the standards person. I didn't know they existed until today when I was Googling, but I am, because I'm sorry, but there are a heck of a lot of people who are very, very poorly, who've, for one reason or another, got a family that doesn't want to either get in touch with an MP, or maybe they don't want to publicise it. Maybe they're just incredibly private people. And it's a bit like rock and a hard place for many people. It's like, hang on, I know that I'm at risk of starvation in a hospital, or whatever other poor care, that because of there not being a NHS protocol for very, very severe and severe ME. But what do I do? And the community obviously rightly says, well, hang on, we need to kick up a fuss here and make people aware of this issue. Maybe the NHS Trust will change their mind. But you can only do that with the express permission of the patient and or their family. And it's a really, really tricky place to be when you've got so little energy. It might take you 2 days to write a message. Anyway, that's kind of where I am right now. Systems based, yeah, there's a heck of a lot of stuff where the framework and the system around certain processes simply is not fit for purpose at the moment. It's very ableist and, oh yeah, come to our surgery on Saturdays. It's like, what if you're bedbound in a hospital? Anyway, I'm going now. I hadn't planned on doing a video today, but there we go. I just read that email and thought, oh, yeah. I just thought sometimes we have to think of the wider issues. Obviously, my heart is with ME, but you have to think, hang on, that's what's happening with ME right now. But who else does it impact? Is this a much bigger issue than simply this one patient in this one NHS hospital and this one MP? No, it's a much bigger issue. Anyway, going now. Thank you very much for watching, and help me to spread the word even wider about Shake It Up. I find it ridiculous that we haven't reached 10,000 signatures in 3 years yet, when this is an issue that affects every single person with ME/CFS, because we've all got PEM in theory. and we could be potentially harmed by graded exercise therapy or CBT. Anyway, I'm going. Lots of love. Catch you later.